Chronic fatigue syndrome is known as ME, and this stands for myalgic encephalomyelitis. Chronic fatigue syndrome is a complicated disorder, and it's characterized by extreme fatigue that lasts for at least 6 months, and it can't be fully explained by an underlying medical condition. The fatigue worsens with physical or mental activity, and it doesn't improve with rest. Only a small percentage of people fully recover. People with chronic fatigue syndrome tend to frequently pick up coughs and colds. They also have trouble fighting off what they pick up. They're most susceptible to and affected by invaders like viruses, bacteria, parasites, candida, and toxins. People with chronic fatigue syndrome also have a higher occurrence of allergies than the healthy population. The endocrine system of people with chronic fatigue syndrome seems to be out of balance. Cortisol and DHEA are hormones that are released by the adrenal glands, and they're invariably low in people with chronic fatigue. They work together to control how the body responds to stress. Low levels of these hormones can cause fatigue, hypoglycemia, poor brain function, allergic reactions, anxiety, and many other problems that are associated with this condition. There's many different causes of chronic fatigue, such as medication. Blood pressure medication tends to depress the entire nervous system, as well as deplete the body of the vitamins and nutrients that it needs to produce energy. This can be a major trigger of chronic fatigue. Besides all the other extremely negative side effects of taking statins, one major side effect that's often overlooked involves the drug's tendency to inhibit muscle growth and the production of energy at the cellular level. As a result, many people who take statins experience a steady decline in energy levels over time, which can develop into chronic fatigue. Benzodiazepines are commonly prescribed to treat anxiety disorders. It's to induce sedative effect, and this tends to elicit drowsiness. This often worsens as a patient develops a tolerance to the benzodiazepines and begins taking higher doses of these drugs. The end result for many people taking benzodiazepines is a chronic lack of energy and drive, also known as chronic fatigue. A poor diet and a lack of vital nutrients tends to cause acid reflux and various other digestive disorders in many people. And while proton pump inhibitors can offer immediate relief from such symptoms, these drugs also tend to deplete magnesium stores in the body. And a magnesium deficiency can lead to a host of severe illnesses, including extreme weakness and fatigue. Histamine blockers, or antihistamines, often induce tiredness and drowsiness in patients, which over time can worsen and develop into chronic fatigue. In mainstream Western medicine, serious behavioral disorders like schizophrenia and bipolar disorder often call for harsh antipsychotic medications. But because these drugs, like Abilify and Risperidone, are powerful depressants, they tend to induce extreme fatigue, lethargy, and overall weakness in many patients. Antipsychotics also tend to artificially lower dopamine levels in the body, and this can lead to chronic fatigue. You could see my other videos on schizophrenia and bipolar for more natural treatment options for these conditions. At least 30 million Americans now take some type of antidepressant drug to manage an anxiety disorder like depression, as well as to treat chronic pain and other related conditions. And while common antidepressants mask the undesired symptoms in some patients, they also tend to trigger fatigue, especially during the first few weeks of treatment. By inhibiting the normal function of the brain neurotransmitters like serotonin and norepinephrine, antidepressants also obstruct natural hormone levels, which in turn can lead to chronic fatigue. Another common yet unsuspected side effect from taking antibiotics is they can often cause extreme fatigue and tiredness. Many people who have trouble urinating or who have high blood pressure take diuretics to help to boost the elimination of water from their bodies. But the diuretics also tend to draw out necessary electrolytes like sodium, potassium, and chloride, as well as them leading to severe mineral deficiencies. And it's these deficiencies that can bring about chronic fatigue, as the body struggles to produce enough energy due to the lack of proper nutrients. As the primary target is the nervous system, chronic mercury exposure can cause symptoms like fatigue, weakness, headache, and poor recall and concentration. In severe cases, chronic exposure leads to intellectual deterioration and neurologic abnormalities. One possible way that you can be exposed to mercury is through mercury amalgam dental fillings. Interestingly, the amount of damage that these fillings can do varies greatly from person to person. As for one, some people have more acidic saliva, which can lead to more mercury from the fillings being leached out than others. A urine mercury test may not detect any toxicity, as mercury gets taken up and it lodges in the brain, where it needs a chelating agent to remove it. Some of the best herbs to help to chelate and remove the mercury, which can cross the blood-brain barrier, are cilantro and chlorella. Your body also uses selenium to help to produce glutathione, which is the master antioxidant, and it then uses this to remove mercury. If you're experiencing mercury toxicity, your selenium levels can be drained, and your glutathione, which is normally carrying out many beneficial functions, ends up getting wasted on removing the mercury toxicity. In order to get the required daily dose of selenium, you can eat 3 Brazil nuts per day. A high percentage of people with chronic fatigue syndrome and fibromyalgia are affected by everyday chemicals. This is known as a multiple chemical sensitivity. Perhaps the brain is more sensitive to chemicals, and it causes the person to have a strong physical response. There also seems to be a consistently low level of the body's most powerful antioxidants, which impairs its ability to fight off the toxins and free radicals. When there's not enough glutathione available in your blood, cells and liver, these toxic chemicals start to build up in your body, and that's when you start to feel tired and even foggy. Signs and symptoms of a deficiency in glutathione may include anemia, the build-up of too much acid in the body, which is known as metabolic acidosis, frequent infections, and symptoms caused by problems in the brain, including seizures, intellectual disability, and the loss of coordination. You can increase your glutathione levels by taking reduced glutathione at up to 1 gram per day, taking the precursor N-acetylcysteine at doses of 500 milligrams 3 times per day, taking the herb milk thistle, getting your daily selenium, and also eating asparagus. A significant proportion of people with chronic fatigue syndrome have food intolerances. There's often an improvement in their health when certain foods are eliminated. An undiagnosed digestive or assimilation condition can interfere with energy production, and it can also affect nutrient absorption, leading to chronic fatigue. One of the most common undiagnosed problems here would be a gluten sensitivity. It's worth trying 1 month gluten-free to see if this makes any difference to your health and well-being. You should note, as gluten acts on the same receptor as opium, it can be very difficult for some people to abstain from gluten. Gluten can be degraded into several morphine-like substances, named gluten exorphins. These compounds have proven opioid effects, and they could mask the deleterious effects of the gluten protein on the gastrointestinal lining and the function. It's also important to note that glutinous crops can be grown in glyphosate or Roundup sprayed fields, and many of the symptoms of glyphosate poisoning could be misinterpreted as a gluten sensitivity. Studied strains of probiotics have demonstrated a significant effect on modulating the anxiety and the inflammatory processes in chronic fatigue syndrome patients. The best probiotic is called VSL3. You can also try to add probiotic fermented foods like kombucha, kefir, sauerkraut, and kimchi to your diet. Enzymatically preserved colostrum powder and the amino acid L-glutamine can help to heal a leaky gut, which can further help to reduce toxin exposure and improve nutrient assimilation, helping the chronic fatigue. Digestive enzymes may also be a great addition to help to speed up nutrient assimilation at the start. Carnitine is essential for mitochondrial energy production. Disturbances in mitochondrial function can contribute to or cause the fatigue seen in chronic fatigue syndrome patients. Previous investigations have reported decreased carnitine levels in chronic fatigue syndrome patients. The form acetyl L-carnitine is taken in doses of 2 to 3 grams per day. Not only has it been shown to improve cognition, it also has life extension capabilities, especially when combined with the anti-diabetic substance alpha-lipoic acid, which is taken in doses of 600 milligrams 2 to 3 times per day. Vitamin B12 and Ab complex. B vitamins play a critical role in beating chronic fatigue because the body uses them to metabolize energy. And since many people today suffer from B vitamin deficiency anemia, supplementing with a B complex vitamin, and a B12 in particular, can make all the difference in alleviating tiredness and sustaining high energy levels. Make sure to get a good quality multi-B vitamin with a B12 in the form of methylcobalamin. It may be necessary to also add a separate B12 at 5,000 micrograms per day. The blood test for B12 deficiency may be unreliable, as food is now fortified with folate, and this can give a false reading on the blood test, hiding a deficiency. Trace minerals and concentrated mineral drops. A mineral deficiency is another common cause of chronic fatigue, as a mineral deficient body lacks the ability to effectively regenerate cells and produce adequate energy. This is why regularly consuming the full spectrum of ionic trace minerals, which includes nutrients like magnesium, chromium, iron and zinc, is vitally important for treating chronic fatigue. Shilajit, humic and fulvic acid are some sources of trace minerals. Patients treated with magnesium claim to have improved energy levels, better emotional state and less pain, as judged by changes in the Nottingham Health Profile. 12 of the 15 treated patients said that they had benefited from the treatment, and patients' energy scores also improved. Take magnesium in the form of magnesium bisglycinate. Start to slowly increase your dose until you experience side effects like stomach discomfort or diarrhea. Then gradually reduce the dose until you're able to determine your maximum tolerable dose, which doesn't cause any stomach discomfort. As magnesium is required for the proper functioning of over 300 enzymes in the body, profound benefits may be noticed after a few months of supplementation. Just like magnesium being required by over 300 enzymes, zinc is required by around 100. Since zinc is a strong antioxidant, the present results further support the findings that chronic fatigue syndrome is accompanied by increased oxidative stress. The result of these reports suggests that patients with chronic fatigue syndrome should be treated with specific antioxidants, including zinc supplements. Typical recommended doses of zinc are 30 to 50 milligrams per day. However, be careful, as many forms of zinc are poorly absorbed, some as low as 20%, meaning you'd need 5 tablets to actually achieve the blood levels of one fully absorbable form of zinc. Bee pollen, considered by many to be the perfect food, as it has a unique balance of beneficial enzymes, proteins, amino acids, vitamins and minerals. It's another excellent option for people who struggle with chronic fatigue. The synchronistic effect of the bee pollen's multitude of nutrients can help to alleviate both the physical and the intellectual tiredness and provide lasting energy throughout the day. Maca has been used medicinally for thousands of years, particularly in Southern America, where it grows abundantly at high elevations. Maca is another powerful superfood, and it normalizes hormones and boosts energy levels, because it helps to balance a variety of systems throughout the body. Maca is quickly becoming a go-to treatment for many people who are trying to treat their chronic fatigue symptoms. Antioxidants have been shown to be reduced and free radical production increased in people who have chronic fatigue. Vitamin C is another powerful, energizing nutrient with amazing potential to eradicate chronic fatigue symptoms. Typical oral supplementation with ascorbic acid and other common forms of vitamin C can provide only limited benefits, as only a small amount of vitamin C ends up being absorbed in the body, while the rest is eliminated. By supplementing with liposomal vitamin C, which some say is the equivalent of getting high-dose intravenous vitamin C injections, you may be able to improve your condition. A continuous onslaught of ionizing radiation and fluoride chemicals, combined with a lack of iodine in the diet, has left many modern people grossly deficient in the necessary nutrient. An iodine deficiency causes many people to feel sluggish, perpetually tired, and devoid of energy. The accumulation of fluoride, radiation, bromide, and other iodine-replacing chemicals in the body can severely disrupt the glandular function, which in turn causes imbalanced hormones, poor circulation, low body temperature, and other problems linked to chronic fatigue. Thyroxine is a hormone excreted by the thyroid gland. Studies consistently reveal that an underactive thyroid is present in many people with chronic fatigue. The best non-toxic form of iodine is nascent iodine. Other sources are bladderwrack seaweed tincture. The government's recommended dose of iodine is 150 micrograms per day. However, Japanese populations who eat lots of seaweed can consume up to 3,000 micrograms per day. Ribose is an energy source that the body makes from food. There's some evidence that supplemental ribose might prevent muscle fatigue in people with genetic disorders that prevent sufficient energy production by the body. It might provide extra energy to the heart during exercise in people with heart disease. D-ribose significantly reduced clinical symptoms in patients who were suffering from fibromyalgia and chronic fatigue syndrome. Typical doses are 5 grams, which is 1 teaspoon, taken 3 times per day. Ribose is known as the only sugar that actually lowers blood sugar levels. Therefore, it may also be of benefit for diabetics, allowing them to reduce their insulin dose. Studies have shown that coenzyme Q10, CoQ10, and nicotinamide adenine dinucleotide, or NADH, which are common antioxidant dietary supplements, have known cardioprotective effects, and they might relieve symptoms of chronic fatigue syndrome. The NADH is very expensive. However, its precursor, niacinamide, is much cheaper, and it may be of benefit. You could check out the benefits of high-dose niacinamide in my video on schizophrenia. The best form of coenzyme Q10 is ubiquinol, and doses should range from 200 to 400 milligrams per day. The mitochondrial boosting energizing effects of coenzyme Q10 can be enhanced when taken with PQQ at doses of 20 to 40 milligrams per day. Check out my other video on mitochondrial boosting supplements for more ways to enhance this. There was significant attenuation of oxidative stress as well as TNF-alpha levels. These findings strongly suggest that during immunological activation, there is a significant increase in oxidative stress, and curcumin can be a valuable option in the treatment of chronic fatigue syndrome. Doses of curcumin can range from 2 to 5 grams per day. Its absorption can be enhanced with BioPerin, which is black pepper extract, or by taking it with fish oil, coconut oil, butter, or ghee. Results of a study show a decreased availability of omega-3 polyunsaturated fatty acids plays a role in the pathophysiology of chronic fatigue syndrome and is related to the immune pathophysiology of chronic fatigue. The results suggest that patients with chronic fatigue syndrome should respond favorably to the treatment with, among other things, omega-3 polyunsaturated fatty acids high in EPA and DHA. Doses can range from 3 to 9 grams per day, of an EPA DHA molecularly distilled omega-3 fish oil blend. Resveratrol may be effective for improving fatigue symptoms and for enlarging the atropic hippocampus by repressing apoptosis and promoting neurogenesis. Resveratrol is found in small amounts in red wine and Japanese knotweed. It's been shown to increase the lifespan of mice by around 7%. Typical doses range from 500 to 1000 milligrams per day of trans resveratrol. Patients with ME or chronic fatigue syndrome have reduced levels of vitamin D in their blood. Studies in patients with other diseases like diabetes have shown the reduced levels of vitamin D are associated with increased risk of cardiovascular disease like heart attack and stroke. You can get a 25-hydroxy vitamin D blood test to assess your levels and then supplement accordingly with vitamin D3 to correct any deficiency. Melatonin is a hormone released by the pineal gland. Its primary function is to control sleep patterns. During the day, the pineal gland is stimulated by light, and it communicates to produce chemicals such as serotonin to wake the body up. When light levels fall, the pineal gland signals the production of melatonin, preparing the body for sleep. Melatonin production appears to be disturbed in chronic fatigue syndrome patients, causing a lack of deep, restful sleep. People with candida or yeast overgrowth show many of the same symptoms as people with chronic fatigue syndrome. Studies reveal that the flora of the intestine can be disturbed by factors like antibiotics, and it can allow candida, which is always present in the body in a harmless form, to proliferate and cause ill health. Research has shown that an elevated level of candida overgrowth is associated with allergies, irritable bowel, fatigue, memory impairment, foggy brain, and muscle pain. In diagnostic labs where it's possible to test for yeast overgrowth, physicians consistently report a correlation between candida antibodies and chronic fatigue syndrome. Many people who have these conditions have reported dramatic health improvements through antifungal agents and antifungal protocols. You could check out my video on candida for more natural treatment options. A significantly high percentage of people with this condition appear to be highly driven and put a lot of pressure on themselves. They're often perfectionists. Stress may be a root cause of chronic fatigue. There's no doubt that people with chronic fatigue syndrome have an impaired stress response, and there's also much evidence to suggest that stress impairs the immune system. Recently, meditation has been shown to reduce the symptoms of fibromyalgia and chronic fatigue syndrome. People with chronic fatigue syndrome can sometimes suffer from cognitive difficulties. They often feel overwhelmed by sensory information, such as sounds and smells, especially in busy public places. Their skin is often sensitive to the touch. Experts believe this could be explained by neurological dysfunction, which processes information as vitally important when it's not, making these people feel overwhelmed. This suggests a deficiency in certain vital chemicals in the brain. You can check out my video on brain-boosting herbs, on nootropics and on choline sources for many ways to help to boost cognitive performance, which could help to deal with the recovery of chronic fatigue syndrome more easily. Adaptogens are herbs which are renowned for balancing any and all imbalances in the body. They may be helpful when dealing with chronic fatigue or ME. Some of these herbs are ginseng, both Eleutherococcus and Panax ginseng, ashwagandha, reishi, cordyceps, schisandra, and rhodiola. Chronic fatigue can have many causes, and luckily there's lots of proven ways to help to treat this condition naturally. It's important to supply your diet with an abundance of nutrients, such as a multi-B vitamin, a separate B12 and niacinamide, omega-3s, micronutrients, magnesium, Coenzyme Q10, PQQ, and D-ribose. You can help to alleviate the inflammatory stress that contributes to the chronic fatigue with powerful anti-inflammatories such as curcumin and vitamin C. One of the best ways to help to treat the inflammation is to cut out pro-inflammatory poison, that is sugar, and to adopt a low carbohydrate, low GI or ketogenic diet. Remember, blood sugar level fluctuation can seem like chronic fatigue. Every time your levels crash, leading to the addictive behavior of seeking more sugar to try to falsely boost your energy again. You can see my other video on blood sugar for more helpful natural information. You should stop eating processed foods and instead eat antioxidant-rich vegetables and herbs whenever possible. You can help to detox from substances that could be interfering with energy production or causing fatigue and brain fog by increasing substances like glutathione and vitamin C. No matter how tempting or necessary it seems, you should avoid stimulants like caffeine or yohimbine, as these will only make matters worse in the long run. A final part of treating chronic fatigue is to make sure that you're having sufficient sleep. You can see my other video on herbs to help sleep for more information about this, or my detailed video on melatonin. For more detailed information about the herbs or supplements mentioned in this presentation, go to my website.